This video is to demonstrate the proper removal of a central venous catheter, also known as a central venous access device. A physician's order is required for the removal of a central venous catheter. Please check the order before proceeding. The central venous catheter will be removed by the IV team or a specially trained RN who is aware of the potential complications of a catheter removal and shall be prepared to initiate emergency measures as needed. Before beginning the procedure, identification of the patient is necessary using two identifiers.
Hello. Could you tell me your name and birthday, please?
Debbie Jenkins, and November 30th, 1980.
Thank you.
The equipment needed for the procedure include the following: non-sterile gloves, 2 4x4 sterile dressings, triple antibiotic ointment, alcohol swabs, a biohazard bag, a ChloraPrep swab, a suture removal kit, and a transparent semi-permeable membrane dressing. Perform hand hygiene, preferably in view of the patient if possible.
Okay, Mrs. Jenkins, we're going to take out your central line. So what we're
Okay.
going to do, we're going to remove the dressing that's already on there. We're going to clean the site so we make sure we don't have any risk for infection.
Okay.
And then I'm going to have you take a breath in, and when I pull out the central line, I'm going to ask you to hum, okay?
Okay.
So we're going to go ahead and practice that. Now we're going to take a deep breath in, and then just hum when we exhale. Perfect.
Is that okay?
That's great. Thank you.
Place your patient in supine position or as low as possible to reduce the risk of an air embolus. Remove the central line dressing and stabilization device as indicated. Prepare your equipment and remember to apply the antibiotic ointment to one of the 4x4 gauze pads. Disinfect the skin junction with ChloraPrep for 30 seconds and allow to air dry. Remember to scrub the area in a basket weave pattern. Remove the sutures or staples if applicable. Hold the plain 4x4 gauze gently to the insertion site with your non-dominant hand. Using gentle, even pressure, Slowly retract the catheter from the site with your dominant hand while the patient is performing the Valsalva maneuver.
Okay, Mrs. Jenkins, we're going to remove the line now. I'm going to have you take a breath in and then hum.
Okay.
Perfect.
If resistance or complications occur, discontinue removal and notify the physician immediately. If your patient is unable to perform the Valsalva maneuver, remove the central venous catheter during the expiratory phase of the respiratory cycle. Apply digital pressure to the site with the gauze for a minimum of 1 minute or until bleeding is controlled. Assess the integrity of the removed catheter to the original insertion length to ensure that the entire catheter has been removed. Now apply the 4x4 gauze with ointment side down to the insertion site. Remember to exchange the 4x4s during expiration, asking the patient to hum.
Okay, Mrs. Jenkins, last time I'm just going to have you hum so we can apply a new clean dressing.
Okay.
Perfect.
Dispose of any waste in a biohazard bag and any sharps in a sharps container. Your patient shall remain in supine position for 30 minutes after the central venous catheter removal. Assess for complications. If the patient cannot tolerate the supine position, the head of the bed can be elevated as appropriate. On any ventilated or intubated patient, please consult with a critical care physician before proceeding. Documentation upon removal of the central venous catheter should include the date, the time, catheter integrity and length, the site condition, dressing application, and the patient's response to the procedure.